The National Sleep Foundation found 45% of Americans say they don't get enough sleep or it's not very restful when they do. Sometimes it's because of something more serious like a sleep disorder, and that's where a sleep study can come into play. Dr. Rakesh Alva joins us now to explain exactly what a sleep study is. He's a pulmonologist and sleep medicine specialist at LeBauer Pulmonary Care and a member of the Cone Health Medical Group. Thanks for being with us.
Thank you for having me, Shannon.
So what happens in a sleep study?
So a sleep study is performed for various reasons, obviously to diagnose sleep disorders. The most common type of sleep disorder by far is obstructive sleep apnea, where people actually stop breathing in their sleep without realizing it. Other forms of sleep disorders that sleep studies can be done for include what we call restless leg syndrome, or sometimes people are exceedingly sleepy in the daytime for various reasons. And then there are some other people who, for whatever reason, are acting out their dreams or having what we call parasomnias, which are abnormal behaviors during their sleep. So sleep studies can be done to diagnose any of these types of conditions.
So do you go into a clinic, lay down and go to sleep, and someone observes you?
So sleep studies broadly are of two types now in 2019. The classic form of sleep study that we think about is where a person actually goes to a sleep center, gets all wired up, and actually has to spend the night there, where we record various things, including their brain waves, their heart activity, their breathing, muscle twitches, and all kinds of things. Lately, we also have a form of sleep study that can be done at home. A home sleep study is a very focused form of sleep study where the person wears simply a belt around their waist, an oxygen probe on their finger, or an oxygen cannula in their nose. And this study is obviously more convenient to the person because it can be performed in their home environment and they can be sleeping in their own bed. The study is somewhat focused, though, and limited in the information we get because it's focused on diagnosing obstructive sleep apnea.
So when do you seek this medical help? How do you know you might be a candidate who needs to have a sleep study?
So some of the common symptoms of obstructive sleep apnea would be, loud snoring. Very commonly, a person comes to seek attention because their bed partner has actually seen them snoring very loudly, and not only that, but stopping breathing in their sleep, or choking or gasping in their sleep. Other reasons could be if people are exceedingly sleepy in the daytime, cannot get through their work day for whatever reason, and they're napping everywhere, clearly problems driving. And then some of the other symptoms could be, if the bed partner again notices them moving their legs around a whole lot and things like that.
All right, well, it is great information, and you can find out more. I know this affects a whole lot of people about sleep studies and sleep disorders. Just go to health.com/sleep, and for more healthy lifestyle tools and resources, check out conehealth.com/wellness-matters.
House Call on Fox 8 is sponsored by Cone Health.